Friends, we are describing a technique of retrograde anchor for bony Bankart fixation. We use a glenoid bone block jig to drill a 2.3 millimeters tunnel at the level of glenoid neck, and this will serve as our tunnel to guide in a 2.3 millimeter all suture retrograde Bankart anchor from osteocare. This anchor is passed in two steps. In the first step, we would pass a wire, a chia wire, and over that a looping suture is passed into the glenoid neck. Once the looping suture is passed into the glenoid neck, a retrograde anchor is passed over that, and as soon as it is passed underneath the cortex, it is locked. So you can see the anchor which is coming in here. The anchor needs to be pulled very slowly so that it locks into the subchondral bone. So we'll just pull it very lightly so that it locks into the subchondral bone at the level of glenoid neck. So this is the anchor which is pulled and which is getting locked. Now it's a single loaded anchor. There are two sutures of number 2 UHMW wire which are used. So you can see now that there is a fragment, there is a bone fragment which is separate and which needs to be fixed. We do a generous elevation of the Bankart tear, and this is evident by the subscapularis muscle fibers that we can see on the glenoid neck area. Here you can appreciate that the bone fragment is displaced and this fragment is rotated. So now we need to derotate the fragment and fix the fragment back into its position. Once the fragment is reduced and put back into its position, the two wires are passed into the glenoid labrum and the capsular tissue, and the bone fragment is fixed with the Noteless push lock type of an anchor. So what we do now is we place the bone block onto its place from where it is detached after derotating the main fragment, and then we will pass the two suture limbs of the retro anchor one by one through the Bankart and the capsulolabral structures, and this will cover the bone block as well as the labrum together. The important thing to note here is we don't have to pass the fragment or the wire underneath the bone fragment. This has to be passed only through the labrum and the Bankart tissue. So we can see that we have passed the first fragment now. First wire, the first chia suture is passed, that is railroaded. The wire is railroaded over that fragment, over that labrum, and then we pass on to the second thread. So now both of these threads are passed underneath the labral structures, and then we will again position the bone fragment back into its place, and then we will be using the knotless anchor to reduce it onto its place. Now this bone fragment in this particular case is a very unstable sort of fragment and it keeps on flipping, so we need to be very careful to reduce it and to hold it into its perfect position. Most of the times these fragments are flimsy and you need to tackle them very delicately. So here we are using a push lock anchor to reduce it into its position. So it will be a knotless sort of a technique, and here we are using a probe to reduce the bone fragment into its place. Once the bone fragment is reduced into the place, we will be inserting the knotless push lock anchor into its place. So once the knotless push lock anchor is reduced into the place, the labrum is also closed over the bone Bankart fragment. The probe will help us to just tease away the labrum little far away, but what you can appreciate here is the bone fragment is now setting very uh, perfectly onto the bone fragment, and it is a very nice repair that we can obtain in a double row fashion using this retrograde anchor from Osteocare, because it makes the fragment sit into its position and we are able to drill the anchor just underneath the bone Bankart fragment. Accessory anchors can be inserted to repair the residual Bankart and the labral tissue, and this will lead to a very nice repair of the residual labral tissue as well. So the knotless repair in a double row fashion for the bony Bankart lesions using a retro anchor from Osteocare is a very nice technique to fix up the bony Bankart tissue or the bony Bankart into its position. So here we can see that the Bankart and the labral tissues are fixed into its position. So here we can see that this is the final repair construct of the labrum and the Bankart tissue, and it is repairing very nicely into its position. So not only we have done a labral repair, but also we are able to reduce the bone Bankart fragment into its place. So this is from the superior portal. We can see that the bone Bankart is having a hairline reduction. The joint is very stable, and we have done a remplissage also to make the tissues more stable in this pattern. Thanks a lot for your patient hearing.